Okay, let's go ahead and begin, and others can join as they have time and connectivity. I'm Dr. Thomas Woolsey from the Department of International and Comparative Education, and I'm so pleased to be here today with our distinguished colleagues, and I'm going to introduce them in just a moment. First of all, welcome and happy spring break and Ramadan Kareem to everybody. Today's conversation is primarily about updates for fall and summer semesters. We're going to find out a little bit more about our status on COVID and the updates about that here in Egypt, and also about the various vaccines that may or may not be available. And we're going to first begin with updates from our panelists, and then I'll open the floor to questions after all of them have had a chance to give you a briefing. So before we begin, let me just give you a couple of quick tips or updates. First of all, to ask a question, you have a couple of options. The chat function is not enabled, as many of you would be used to in class. However, we do have a Q&A, and you should be able to see that in your toolbar. And if you type your question in there, I will either read it aloud, or one of the panelists will respond in writing, or perhaps I will. And then you also have the option to raise your hand, and I'll do my best to moderate the hands and direct you to the right person who can respond to your question. And I may ask a question or two myself. So today we have, of course, President Francis Ricciardone, who will have some general updates for us. And then we have Provost Ihab Abdulrahman, and he will have some updates for us about the summer and fall semesters and what we have coming up. We will also have Councillor Ashraf Hatem, who is going to give us some additional updates on COVID-19 in Egypt, and in particular, perhaps of big interest on the vaccines. We have Vice President Dina Borai, who will give us some updates, if I can say that word, some updates on student life activities. And then we also have Ayman Abdelatif, who will talk to us about some of the management and operations and how we're going to be working, at least at this point in time until now, in the near future. So without any further direction from me, let's go ahead to President Frank.
Thank you very much, Professor Woolsey, for the introduction. Greetings to everyone, Ramadan Kareem. It's a pleasure to be with you today. You know, I see these campus conversations as one of those positive results of an ugly situation. I've been looking over the 5 years of my tenure for ways of really letting people on a casual or informal basis get to me and to all of us in the leadership with whatever questions or concerns or rumors or anxieties people may have. We have structured ways to do that. This is a way that is organized, yet lets anybody in who would like to do it. And it gives us a chance to follow up, to take notes and follow up. So I found this a device that I think will outlast the pandemic. I think humanity will outlast the pandemic, and so will AUC, and we'll all thrive. But we've all learned a lot, and this is one of the devices we have. So I see this as a kind of state of the campus conversation that we can all participate in. As I've said repeatedly over the past year, I couldn't be prouder of serving at AUC, and more pleased and grateful for the resilience that our community keeps showing month after month. Now it's gone on well over a year. We're all sick and tired of it, but we've learned to roll with every punch, including the spike in the numbers that we've seen over this past month or so, internationally, nationally, and even on our own campus. If you check the daily dashboard, another device we've come up with starting over last summer, we're up to a rolling average of 16 or so cases a day among our students, faculty, and staff, 16 or more diagnosed cases on a rolling 7-day average. That's the highest it's been. We didn't have our first case until May 7th of last year. So this thing has got bad and serious. Same time, 0 hospitalizations right now, as far as I'm aware, and as far as the dashboard has captured anyway. And that's part of the good news this for whatever reasons, and I'll leave this to the experts to talk about. I want to put a little teaser in here. I see we're up to 71 participants. Those who are participating, you can contact your friends on social media. Dr. Ashraf will be presenting some very good news on the COVID front, but I'm going to leave that for him to say because he's the expert who has really helped to deliver this good news through energetic interventions with the proper authorities. We have a lot going on right now. I wanted to start with eating your peas before getting to the dessert and the other things. I wanted to put in another plug. One of the things we've also developed, I think done well over this past year, is respond to the problem of sexual harassment that is throughout the world in university settings. It's an issue in Egypt. It is an issue on our campus. It is not something that any university can deny. Some universities have been better than others at addressing it. I think AUC has done a very good job at addressing it aggressively, at least this past year, since it really came to the forefront. We had made some starts at it before, but really, I think we've upped our game. And the key element of that is training, mandatory training, not a suggestion, not a guideline, not urging you. It is a requirement for all students and faculty and staff to take anti-sexual harassment training. It's critically important because even definitions of what is harassment need to be we've published them, but people need to understand what they are and talk about them. Sometimes people are surprised about what constitutes harassment. For those who are faculty and staff, this is a condition of employment. If you wish to remain employed at AUC, you must take this training. A good percentage, I'm delighted that something north of 70 or approaching 80% of students have done it, thanks to the energetic campaign of the student union. It's a real credit to the student union leadership for getting those numbers up. On the faculty and staff side, we have more work to do. We, in fact, are working to translate the materials and the training into Arabic for our employees who do not speak English comfortably. That's underway. But all managers, please let your managers on the employee side and on the faculty side, all deans and department chairs should be underlining this is mandatory and it is important and it is urgent and it is a very explicit expectation of performance. If you do not sign up for the training and take it, you are not meeting expectations in your performance, with all that means in terms of evaluation of performance. So please take this very seriously. It is a good thing for strengthening the culture of dignity and respect among us in our community. So I wanted to get that up front. Let me give some more news about what's going on. We have the visit of our new chairman of the Board of Trustees next month after the Eid. He will be on campus for a week. He has been a member of the Board of Trustees for my full tenure. He came aboard when I did 5 years ago. So he knows the place well. He's been to campus, but he really wanted to connect. Under COVID conditions, of course, we're fully online. So there are a few people that he would normally bump into. We will be setting up scheduled meetings with different groups and individuals, of course. But we will also be publishing sort of office hours when people can do drop-bys, even without, if they're willing to wait, on an individual basis, even without appointments. But we will be publishing more about that soon. Our focus on the Board of Trustees meeting for the spring is underway. The meetings will take place over 3 days in May after the Eid. We do a very important work on the budget, the annual budget. That's foremost there. Also very important will be the continuing effort to select a successor to me. We hope for good news on that front next month. By the end of May, we may even have a candidate or several candidates visit as early as late next month. And I'm assured that there are excellent candidates. So I'm reassured and delighted at that. I had no doubt that that would be the case. And I hope everyone else is reassured as well. Looking to my own transition out, I am here on campus and I will be here through what we hope will be graduation ceremonies in person. We're still hoping for that, and Vice President Dina will speak to it through middle of June. There'll be, because of COVID conditions, we will not have any formal farewell event, large event on campus. But I do want to see people. I've made so many friends that I want to retain for life, and others that I hope to, at least one way or another, learn from and hear from as I process out. And so sometime in June, we'll be announcing office hours when people will be available. People can either schedule appointments, students, faculty, staff, or even take their chances and drop by. We'll try to have short things if people want to do photos or handshakes or just say a few words. I'll be happy to meet with people that have come to really enjoy working with all these 5 years. This isn't goodbye now. I'll do. We'll all have another campus conversation or two in the course of May and June. With that, let me pass on to our next speaker in the list. I'll hand it back to Professor Woolsey to conduct the rest of the show. And of course, we'll all be standing by for questions from the participation. I see we've got 88 participants, so maybe I wonder if we'll get any north of that. That's a good participation list right there. Maybe if the word goes out that there'll be some news on the COVID front, we might even get a few more.
Got some prime time Nelson ratings going here. Thank you, President Frank. And for those who are putting in the question and answer, I am seeing those, and we will get to those after each of the other panelists has spoken, so don't worry. Okay, President, how about Provost Ehab? Would you like to make a few remarks, please?
If I may ask Dr. Ashraf Hatem to start first, because I think he has some good news for us, and that will pave the way for me to announce the summer and fall modalities afterwards.
Oh, absolutely. So we'll get to the dessert right away. Perfect. Thank you, Provost Ehab. Go ahead, Ashraf.
Yes. Good afternoon, everybody. Thank you, Professor Woolsey. Happy Ramadan for everybody, and thank you very much. As for COVID in Egypt, everybody knows that we are in the third wave now, and we are still in the ascending limb of the curve, so the numbers are going up. The hospitalization also is coming up, not, alhamdulillah, not from AUC community, but from all over Egypt. So we have a 60% now occupancy in the hospitals and more than 50% inside the ICUs beds. So, and the only way to combat this is, of course, the using the masks and the distancing and so on. So, but to end the thing is vaccination. And up to now, the only official way of vaccination in Egypt is to register. Everybody must register on the Ministry of Health site for vaccination and to put his ID number, either the national ID number, or if he's a foreigner, his passport number, and they will call him and he will go to get his vaccination. The vaccines which is available in Egypt, we have the two vaccines, the Chinese one, the Sinovac, and also some less the Sinopharm, and also we have the English Swedish vaccine, the Oxford AstraZeneca one, and to a very lesser way we have the AstraZeneca one, the AstraZeneca one, and the Pfizer one only for diplomatics in the U.S. Embassy. The good news, actually, there was a meeting between President Francis Ricciardoni and Professor Ehab, was the Minister of Health, for some business, and we had a request from the AUC administration that the AUC community needs to be vaccinated so that we can return face-to-face. The Egyptian government decided that in another front that they will open starting from the 1st of May, the biggest vaccination center in Egypt, which will be in the exhibition center, which is near in the Manara, which is near the Mushir Mosque. And this center will vaccinate up to from 3,000 to 5,000 individuals per day. And this will be a huge center. It will be a very much regulated center. And this center, as the assistant of the minister just this morning told me, it will be open for firms and business partners who needs to reopen and to have face-to-face activities like for universities, schools, and private businesses for the tourism sector. And that's why they accepted that the AUC request that we can, immediately after Ramadan, we can vaccinate as our request, the 5,000 of our, according to our request, the AUC request was 5,000 individuals with 10,000 vaccines. It may be more, it may be less, according to the registry, according to what the administration will do. There is a lot of logistics in this, but the government of Egypt and the Ministry of Health and the Minister of Health accepted that we will do this immediately after the Eid. So we will be ready to vaccinate all the who wants to do this from the AUC community immediately after Eid, so that we can, according to the guidelines, we can resume face-to-face activities, and this is the good news. But the thing that it is a long way. We have a lot of logistics to be done, and this I leave Provost Dahab and also Ayman and Shireen Shakir to say how we will register this, how we'll do this with the Ministry of Health, so that we will do all this on only 5 days after Eid. It is 1 week for the AUC. It is a slot for the AUC, which will be given by the Egyptian government. Thank you very much, and I hope this was clear.
Thank you, Dr. Ashraf. That is good news, actually. Ehab, would you like to follow on with your comments on the fall, spring, and
Yes.
anything else that's important?
Okay. Thank you, Thomas. Thank you so much for Dr. Ashraf for your help with the vaccines. This is news that's right out of the oven. It's still hot. We received the news last night and this morning. We're happy about it. And there are lots of details to be worked out. So I will be meeting with my colleague, Ayman Abdul Latif, hopefully by phone today, so we can actually start working out the details. Most important item of that is we ask our community to start registering on the system. This is going to help us a lot, and please keep those information. I think because we're going to ask you to provide us those information so we can provide them to the Ministry of Health. That's on the vaccination, and I'm sure that you will hear more from us after I meet with my colleague Ayman Abdul Latif and put a plan for registration and take care of the logistics. That's one. Two, for the teaching modalities, as of today and before even we hear the vaccine news from Dr. Ashraf Hatem, our plan for the summer and the fall is to continue a partial face-to-face modality. And if the situation improves, we are ready to go back fully face-to-face. If the situation gets worse, then we have to roll back to fully online. So we are ready for all scenarios. But as of today, the courses are already on the system. Students can look at them before the advising to look at which course is going to be partial face-to-face, which course will be fully online, and which course will have only exams face-to-face. That's for the summer. Stay tuned. We may change those as the situation change. I do not expect that the summer will change much. but I expect the fall, based on the news that we received today from Dr. Ashraf Hatem, I expect that our fall modalities, teaching modality may change. And I'm happy to take questions after that, Thomas, if needed.
Okay, thank you so much, Ehab. We're going to go ahead and move on, and I do see some questions here about the vaccine, so we will return to those. And let's go ahead and find out a little bit about the student life updates from Dr. Dina. Would you like to let us know the good news?
Thank you very much, Thomas. I'm very happy to be here. Regarding the summer semester and fall semester, we will always be aligned with what the academic area is doing in terms of if we're going to be partial face-to-face. So in student life, we will also have some activities on the ground. We try as much as we can. We put the condition that we prefer outdoor activities. They're much safer for us until perhaps we all as a community get vaccinated, then we can perhaps allow some indoor activities, but it all depends. It's very hard to say exactly, but we're looking forward to the next phase and a summer term or a summer semester with more activities than we've had the current semester, this semester and the semester before. Regarding commencements, we have good news. We have scheduled all the commencements that have been overdue and we owe to the spring 2020 and fall 2020 classes. And of course, we're also looking forward to the spring 2021 class who will be graduating, inshallah, this semester. So we're going to have quite a number of commencements. They will all be school-based commencements, and we're having them all outdoors. So it'll be as safe as we can with all the mandated, social distancing and wearing masks and so on. So we have set the dates. They're June 2nd and 3rd. June 6th and 7th, and June 9 and 10, and June 16 and 17. There will be 10 commencements. With the smaller schools, we combined the commencements. So for example, for HUS and for GAP, we have combined the spring 2020 class with the fall 2020 class. And with the larger schools, with SSE and business, that was going to be just a little, we wanted to be safe and we wanted to make sure the numbers were as safe as possible. So that's why we've ended up with 12 commencements, some in the mornings. We'll have 4 in the mornings and 6 in the evenings. And we will, it will be outdoors. We provide shade, and I think it's going to be a wonderful celebration of and coming together of for graduation. Graduation is our ultimate event where we celebrate the success of all of us, faculty, students, of course, and staff. These are my updates. Looking forward to better times with this wonderful news of vaccinations coming soon for all of us and making us all safe. Thank you.
So very true, Dr. Dina. I think that our resilient students have done such a fantastic job of just coming through when they know that we can't do the commencements on the ground and being so patient. So yes. I give a big shout out to all of our students who have graduated or will soon be doing so. I think the next thing we would like to find out is some of the logistics. So Ayman, would you like to comment?
Yes, thanks, Thomas. Nothing that I have in terms of announcements compares with the announcement that Dr. Ashraf made and that we've been all very eagerly awaiting. So I will be working very closely with Ehab and with the rest of the team to work out the logistics and the details of how this will happen, and we will be announcing it as soon as we are done with that. In the meantime, we continue to work through the clinic with the AUC community. We've had an increase in the number of people who are connecting with the clinic. It reflects the state of the nation and the state of the situation. Stay safe, everyone, but I did want to make sure everybody is aware that the clinic is there to support and help. We continue also to work on the internal schedules, for example, the bus schedules, the food vendor availability, to adapt to the modality that we have in terms of whether we're fully online or in person. And so you may notice some changes in the bus schedule. We'll continue to adjust them, and we get feedback, and we continue to work with the community to adjust and make sure that we're trying to be as efficient as possible and as effective as possible. We also, in terms of remote work for staff, no changes, and no changes are expected. Continues to be down to the employee and the supervisor, the manager, to determine what works best for them in terms of if the position allows for work from home or remote work, then that's something that they have to agree on and continue to work on, but no changes are expected. Finally, we have managed finally to increase the bandwidth. I know I announced previously that we were targeting an increase of about 35% in our internet capacity and bandwidth, and we were having some problems, logistical problems with Telecom Egypt and such, but finally last week we managed to get it through. I hope everyone has seen and experienced the improvement in the bandwidth, and it's a 35 increase, so it's not a trivial increase. Happy to announce that. And we continue, of course, to provide the data lines for students through Orange. There's a special deal for that for the students. If you haven't taken that into account, please do. For staff and faculty, we continue to also provide the corporate rates for them, so that we have, because we're going to be in this hybrid scenario even post-COVID. So to the degree that people are able to make use of those benefits, I would urge you to do so. If you have any questions about the data lines or the mobility, please send an email to aucmobile@aucegypt.edu. aucmobile@aucegypt.edu. Apart from that, please stay safe. Wear your masks on campus if you have to be on campus. This isn't over yet. Hopefully soon, this is the final stretch. Thank you, Thomas.
Thank you so much, Ayman.
And sorry, and I neglected to say Ramadan Kareem to everyone.
Yes, yes. Ramadan Mubarak. Thank you so much. You know, I think this has been such a great campus conversation because we have so much good news, and hopefully things will be changing for all of us soon, for the country and of course for AUCans. There are a number of questions in the chat, and I think most of them are related to the vaccine distribution. Provost Ehab says that we will be getting some more information on that soon. So I think we're taken care of on that front. That's still to come because this news is so fresh. There are others about other questions, and maybe Dr. Ashraf, you could comment on questions that go back to, excuse me, can we go back to teaching face-to-face in Nepal if we're mainly vaccinated? Other questions have to do with, do we have choices for the vaccine we get? Will Pfizer be available? And will we be doing a hybrid model for fall? And maybe Ehab, you'd like to also weigh in on that one. So please, Ashraf, and maybe Ehab, please.
Yes. The only officially available vaccines in Egypt is the Sinovac, the Chinese, the AstraZeneca, which is the English one, and very soon there will be Sputnik V, also the Russian one. But Pfizer is not available. It was only available for diplomats in the U.S. Embassy and for some it is not available in the market in Egypt, and the Egyptian authorities didn't approve it yet. So these are the three which will be available also for vaccination. If there will be any choice to choose or not yet, we don't know yet. But actually, there is no great differences between each one of them. There are, for each vaccine, there are some advantages and disadvantages of each one. The most safe one, which is the least side effects, is the Chinese, but they are the least potent. And the others have some allergic reactions, something, but they are more potent. So to choose the vaccine, I don't think it will be available, especially if they are vaccinating from 3,000 to 5,000 individuals. But some individuals who have certain diseases, for example, autoimmune disease, allergic diseases, very old persons with comorbidities, we prefer to give them the Chinese one. But it is there will be, I don't think at this moment that there will be a choice between vaccines in this center.
Okay, thank you. So I think you've answered also a question that I'm seeing here about vaccines for students. Which one is being recommended?
Excuse me, I didn't hear.
Oh, apologies. There's a question here from Inji about are there specific recommended vaccines for our students? And I think you've answered that.
Yeah.
Okay.
I think any vaccine is good. Any vaccine is better than not vaccinated. Any vaccine is good. So what you find, just vaccine, take it. Myself, I have taken the AstraZeneca vaccine. Frank in the States, he has taken I think the Pfizer or the Moderna vaccine. So it's what available.
We will be grateful for whatever we can get, I think, at this point. We're seeing, I see a question about vaccination conducted on campus, and I believe EHAB has now answered that question by responding that it will be forthcoming information. We have Habiba from the Caravan is asking about, since the summer is a short semester, will it defer in taking the decision compared to the fall semester regarding the mode and exams? And I'm not exactly sure. Ehab, do you understand the question here? Or do we need to get
I will try to answer all possibilities for for the question. So Habiba, if you're answering, are we going to delay our decision a little bit so we can actually be a little bit more sure about the situation before we decide on the summer? I think the students, parents, and faculty need to plan, so we will give them an ample time to plan. So far, we decided the summer will be partial face-to-face. However, we need to understand that the university may change its position to go back fully online or fully face-to-face during the summer if the situation change. I do not think the situation will change much to allow us to go back fully face-to-face. So I'm assuming that the summer will continue partial face-to-face. While the fall, actually, I hope with that good news now about the vaccine, I really hope that we can resume classes fully face-to-face in the fall. We will work hard on actually doing this. I see another question at the very end, Thomas, about, I don't see it now, maybe it's someone else from my colleague.
There's one here about clinical trials. And I've actually, I think you've covered several of the questions online, and of course, you're welcome to raise your hand or reopen the question. Were there any changes that we're anticipating? For example, last March, a year ago, we had to make some changes to deal with the sudden shift in our grading policies and timelines and so forth. Are we anticipating anything like that at this point from this point forward for perhaps summer or fall semesters?
As you know, I have communicated to the Senate to look at all of our grading policy at large, and review it in light of what's happening and in light of what's happening also in higher education in North America. And I know that the Senate has been working hard on that, on the grading system, restudying it, and I'm waiting for the recommendation. Once I receive the recommendation, I will discuss that recommendation with the Provost Council, and we will take decision on it. So as of today, there is no change in our grading policy.
You know that the grading policy is at, I think it's at the level of the Executive Committee of the University Senate. So hopefully there will be something for the Provost Council to act on soon or to respond to. I believe, let's see, we've got most of the questions answered. There's one here about the priority of the 10,000 vaccines and the 5,000 who can receive them. And I believe that Dr. Ashraf has now answered that in terms of we need to prioritize the most vulnerable first, whether it's age or debilitating condition and so on. And we have a question about clinical data for the Sinopharm and Sinovac. Did you want to address that really quickly, Ashraf?
Yes, the clinical trials and the clinical data for both the Sinopharm and Sinovac. Actually, in Egypt, we have done some phase 3 clinical trials for the Sinovac vaccine, and also a lot of data we have in the Ministry of Health, and the Egyptian Drug Authority have reviewed all the clinical data for this. The only problem for the Sinovac and Sinopharm that it is an inactivated, we call it killed vaccine, inactivated vaccine. So it is an ordinary classic vaccine, and that's why it has the least side effects for all the vaccines which are available in the market. But again, for the potency, the range of potency, and what we mean by potency, that the effectiveness of the vaccine. When I take the vaccine, there is a possibility of 50% that I'll catch the disease if I be in contact to the virus. It's 50%, 50 to 70%. So it is 50%. But the good thing in this vaccine, in all the trials, that it has 100% potency in preventing ICU admission, preventing mechanical ventilation, and preventing mortality. And this is the most important. So if it is like the influenza vaccine, if I get the influenza vaccine, I can get influenza, but it will be mild, and it will not go to pneumonia, it will not do respiratory failure, and I will not go to mechanical ventilation or ICU admission. Thank you. You are muted.
I'm muted. Our battle cry these days is we're muted, you're muted. There was a question here about new students who are perhaps arriving from outside of Egypt and who they should contact. I think, Shadan, can you broadcast the coronavirus dashboard? And then perhaps, Ayman, would you like to address who a new student, somebody just arriving to Egypt and to our wonderful campus should contact about details?
About details, Dina, I may punt this to Dina. I'm not sure I understand the question. The details on what?
Go ahead.
New incoming students, Thomas?
Yes, Jenna has written, if we have any questions about the COVID situation at AUC, who should we contact, especially for those of us who are new students that will be arriving from outside of Egypt.
Oh, the
Oh,
clinic.
you mean regarding the vaccine? Is that what?
Jenna, I don't know if you're still in the room. Would you like to comment or ask further?
I'm not Jenna, but I asked a similar question.
Okay.
But I was for a specific program, so but I can't answer for her, unfortunately.
Okay. Yeah, I accidentally clicked the wrong J. Sorry, Jenna. Go ahead.
Can you hear me? This
Yes.
is Jenna.
Yes.
Sorry. So like when you're arriving to Egypt and you need to get your test, I was told it takes about 36 hours to get your results. And that, you know, there are certain procedures that, for example, like you don't need to self-quarantine, you know, there's and things that will change, you know, you guys are saying things now and inshallah they continue, you know, at this rate, right? So if we have questions, who might we contact, you know, a couple of months from now when we're booking flights and things like that? You know what I mean?
For
Yes.
medical, it will be the medical clinic, Dr. Basim.
Exactly. It would be the clinic. It's AUC Egypt.edu. And then I suspect if you have a problem, please reach out to any one of us immediately, and we can support you. Needless to say. So Ayman.Abdellatif, you see my name at AUC.Egypt.edu. I'm sure Dina would volunteer hers as well. Just any one of us who can support you and help would be happy to do so.
In the International Office of the IPSO, we have a services unit, and just write IPSO, and we will respond right away to the email. Yeah.
Okay. I think we covered a lot of the vaccination questions. President Frank has a comment. Would you like to make that now? And then we can perhaps, if we have time, address a couple of the remaining questions.
Sure. Actually, two, and I think I might have accidentally responded to one of the written things and I didn't really respond. I wanted to assure people that what Egypt is doing is absolutely in line with my own experience of what the United States is doing. Well, Egypt is more centralized, of course. The United States is more decentralized. But even on that decentralized basis in the US, patients typically do not have a choice. And you don't know at any particular vaccination site what is going to be available when you got your appointment to get your vaccination. You show up and you get one of the, not at the moment it's 2, there were 3 authorized vaccines in the United States approved by the national authorities there, the Pfizer, the Moderna, or the J&J. In the case of myself and my wife, we had appointments on separate days, separate locations. I showed up and they said, you're getting Moderna. She showed up at hers, she got Pfizer. That was before Johnson & Johnson came on the market. And Johnson & Johnson is a third alternative. That's the one-shot one that everyone is really looking to help solve this problem. That's been paused while they look into data on clotting. But I saw an announcement from the United States yesterday that they expect that review will be concluded soon and it will be back in action. We don't have the Sinovac or Sinopharm or Sputnik in the US at this time. AstraZeneca was about to be approved. I don't know where that is right now. So anyway, what each country is doing its best, depending on what's available and what can be manufactured locally. That's one thing. On the broader question we had from several students, I want to assure you, we recognize that any university is a big, unwieldy bureaucracy with different portals of entry. Thank you for being resourceful enough to find your way to this campus conversation. My colleagues have mentioned different offices you can go to, but what we recognize is it's not reasonable to expect students to be experts in the AUC bureaucracy and how to get answers. We have a customer service orientation, and we are trying to make kind of a one-stop. You can, if you're an applicant, if you're accepted and you want to get information, we want to have an easy way to pose your question, and that we route the question so you get if not an instantaneous answer, a prompt answer, not an auto reply saying you will be, sorry, there's nobody home. You will be responded to in passive voice in some period of time. We're working on that. We do have a contact us, a catch-all on our website. We do have a website on COVID in particular that has an active response capability. And as you've heard Vice President Dina say, there's specific offices that you can go directly to if you have the patience to figure out how to find us. We're trying to make it something that doesn't require, a master's degree in bureaucracy to figure out how to get an answer out of AUC. So we're working on it, and thank you for participating and asking those questions.
Yeah, particularly big welcome to all of our new students, particularly those who have made their way here today. We have just a couple of questions. One is about the spring exams being on campus, and I believe that the provost's email has a few days ago responded to that, meaning that there won't be any on face-to-face, but Ehab, is there any change on that?
Thomas, you asked about the spring, am I correct?
Yes, this is from Yuna, and she says, what about the spring 21 exams? Will they be on campus, or will there be a choice?
That's an excellent question, actually. We're monitoring the situation by the day. By close to the end of the spring break, actually, we will be announcing what's going to happen at the remaining part of the spring semester. So for now, just enjoy your spring break. Let us do the work during the spring break, and we'll come back to you in due time.
Okay. I'm not sure if we answered this one. Is it optional for a student to get vaccinated or not? And I think maybe the response is we're still dealing with the situation. Yeah, we're still dealing with the situation, and we'll have to adjust as we go. Ashraf, is there anything more that you want to add on that?
No, I don't think we have anything now to announce. Thank you.
Okay. So I think that we have covered most everything that is in the chat. There were a few actual comments actually that have been responded to by Dina about mental health, in particular for our students. And I think all of us who are faculty know just how much the stress has been on them, from screen time to isolation and so on. So I'll ask Dr. Dina to just once more point out some of the resources that we have, if you wouldn't mind. And we're getting a screenshot now of
Thank you for that. That's perfect. Thank you.
Yeah.
The provost, thank you very much for putting this up. Yeah.
Yes.
We have all the resources you need. You just contact them. It's all very, very private, very confidential for any counseling sessions needed for students. And I'm sure it's the same service offered for faculty. I believe it's for faculty and staff in the email, as you can see. Yes.
Okay, thank you, Dina. All right, I believe that we've covered the questions in the chat. Let me just see if there are any hands raised. I don't see any hands up. So I think it's 1:06, and we'll just hang on for just another moment in case there are other questions that get posted right away. And let's see, Ahmed has asked, would the exam schedule be adapted to account for potential vaccine side effects downtime? And I think as a professor, I can say that most of my colleagues, if not all of them, would certainly understand and do their very best to accommodate whatever, if you're doing your best to protect your health, then of course we have to be as accommodating as we can. Ehab, is there anything more on that?
No, I agree with you, Thomas. Do your best to protect yourself and protect others. We will do our best also to accommodate you.
Yeah, and this is the thing. I think that is really outstanding, and President Frank mentioned this before, is that you've all been so, students, faculty, staff, administration, everybody have been so accommodating and so understanding, and particularly so resilient. I'm just so pleased that if I have to be working while there's coronavirus, that I'm here at AUC because of our proactive stance and our ability to come together to stick together, let me say. So if there are any other comments from the panelists? And I don't see any other questions or hands up. So with that, then I believe that we will be also sharing the recording of this on AUC's channels. Does this go to YouTube, Shadan? Okay, I believe that, yeah, I believe that this will be on the AUC's YouTube channels and other as well soon, and probably in happening at AUC. So with that, I think that the thing I would like most to say to all of you is have a wonderful spring break, Ramadan Kareem, and relax the very best you can. Things are getting better, and it's been such a pleasure to be with all of you today. And let me thank the panelists also, who I think probably won't be getting much of a spring break, but thanks to you, we will all be able to rest a little bit easier in the coming days. If there's nothing else, I'll end the session.
Thanks very much, Tom, and to all participants. Ramadan Kareem, everybody. Thank you.